Hi everyone, it's Dilraj from Pain Free Health back with another video. And today we're going to be talking about Meralgia Paresthetica. Yes, so Meralgia Paresthetica is a condition that causes a burning, tingling, or numbness on the outer thigh. And often it may be mistaken for a back or hip issue, but it's actually something related to a nerve. And it's something we've been seeing quite often in the clinic recently, a fair bit. So I thought it would be good to cover today and have a talk about it. So let's get right into it. So, what is meralgia paresthetica? Like I said, it's a nerve related condition. It affects the sensation on the outer thigh, so you can see in this area here. And it's caused by a compression of the lateral femoral cutaneous nerve. And it's important to note that this is once again a sensory issue. It's not necessarily something that's related to muscle weakness, but rather altered sensation. So that's why patients will often come in complaining about a burning, tingling, or numbness sensation that they have. Where is the nerve? So this nerve runs from the low back, as you can see here, to the pelvis and out towards the front of the hip. And that's exactly where patients will complain about that numbness from, honestly, from about the start of their femur to about almost the full way down. And it's a really weird sensation that patients will have. And that's usually the main thing they come in complaining about is the numbness on the front of the thigh, which is a good indicator for us. And some of the other common symptoms, like I said, burning or tingling, numbness or a decreased sensation. Some will also say they have a bit of a pins and needles feeling that they'll feel on the front of the thigh. And the symptom is usually one sided unless they have paresthetic neuralgia on both sides, but that's not usually the case. And like I said, there's not really a weakness issue, it's rather a nerve related component. And why it happens. So, the number one thing is tight clothing or belt. So this is something we see a lot in police officers who wear heavy belts or mechanics or anything of this sort. Tight jeans is something that's super common as well. Like women who wear tight jeans for a super long time, they may begin getting some neuralgia paresthetica symptoms. Prolonged sitting also can aggravate this. So people with desk jobs, weight gain, pregnancy, repetitive hip flexion, scar tissue from surgery can also cause this, but realistically, anything that increases pressure at the front of the hip can irritate this nerve. So, once again, just reinstating what we said, who is most at risk? People with prolonged sitting jobs, belts such as police officers, pregnancy, runners and cyclists, as well as they have repeated hip flexion movements. But it's important that this could happen. Important to note that this could happen to both athletes and non-athletes. It's all about nerve compression, is what I'm trying to get at here. So let's differentiate it from other conditions because we get a lot of people coming in worried that they have sciatica. This is not sciatica. Sciatica is related to a completely different nerve. Sciatica runs down the back of the leg, whereas the lateral cutaneous, femoral cutaneous nerve, as we mentioned, comes from the front, from the pelvis down to the femur. The symptoms for do not travel below the knee for meralgia paresthetica, whereas sciatica, it runs all the way down the back of the leg. There's no pain with spinal movement in this one. It's not related to a disc or anything. It's simply related to the lateral femoral cutaneous nerve. So, how we diagnose it. And this is something that we really want to make sure we get a good subjective on because the subjective history is a key indicator on diagnosing meralgia paresthetica. Like, we want to know, was it tight jeans? Are they a police officer? Are they a mechanic? Do they wear tight clothing? Because it gives us a really good indication. And after that, we can do some sensory testing. So we can check the sensation on the front of the thigh compared to the other thigh because usually meralgia paresthetica is the condition where you will see that numbness on the front of the thigh. In addition, we can do posture and movement assessments to rule anything out, as well as check hip mobility testing and rule out any lumbar causes as well. So, our treatment approach. So, our treatment approach to Meralgia Paresthetica is we want to reduce the compression first off. So, adjust clothing, belts, and equipment to a more comfortable position where we're not compressing that nerve. So, we want to modify these positions and postures, and we want to restore any mobility that may have possibly been lost. So, we'll do a lot of hip flexor and pelvic work. In the clinic, with the hip flexors, we do a lot of dry needling and shockwave, whatever the practitioner deems is best at pain free. We also do some soft tissue work near the inguinal region if necessary. And we also want to improve stability in the core and pelvic regions as well. And regarding movement education, we really want to focus on activity modification. So try to get out of those positions of long-term sitting if it's related to people who have desk jobs, maybe move the belt for police officers, anything we can to relieve the compression that the nerve is experiencing. So, what are some at home signs to watch for? So, one of the main indicators is symptoms worsen with tight jeans or belts as the nerve is undergoing constriction again. Increased burning with prolonged standing is also a common symptom that patients will experience. Relief with loosening pressure or sitting. And lastly, localized to the outer thigh. So if that numbness, that burning, that tingling is strictly localized to the outer thigh, it gives us an indicator that that is the lateral femoral cutaneous nerve that's under duress. And lastly, just a summary to go over what we talked about. Like I said, Meralgia Paresthetica is a sensory nerve condition. It causes burning, tingling, or numbness in the outer thigh, and it's localized to that region. It's often caused by a compression to the lateral femoral cutaneous nerve near the hip. It does not cause muscle weakness, and it's treatable with conservative care. This is not something that's super severe. Often patients will get quite worried when they experience that numbness on their outer thigh, which is quite understandable, but this is something that's easily treatable, and we can sort it out quicker the earlier you get in for care. So that is just a little quick presentation on Meralgia Paresthetica. I just want to thank you all for listening, and we'll see you at the next one.